Tell us a little bit now about what you can expect in the recovery phase. How long does it take? What's involved in recuperating? And what can a person expect to be able to do once he's recovered, and how long is it going to take to reach that point?
Well, recovery obviously will depend on the kind of procedure you've had. If you've had...
Let's take, for example, say somebody with 2 or 3 levels of spinal stenosis and a spondylolisthesis, say at L4 or 5.
So most likely you've had a laminectomy and a decompression by the procedure that Dr. Ansel just described. You also probably have had a fusion because you had that slippage, just like Dr. Subramanian was describing. So you've had a decompression and you've had a fusion. Amazingly enough, people these days either start walking the next day or the same evening. And the days of, past are long gone where we used to keep patients in bed for multiple days before we would let them walk. So our goal now is to allow them to ambulate, start walking the very next day, physical therapy for the next few days while they're in the hospital, and depending on how well they're coming along and what their condition was prior to surgery, they would either, say, go home with some physical therapy and continue to walk at home, or go into what we call a rehab facility where you transition between hospital to a semi-acute setting before you get to home. So hoping that by 3 weeks or a month, you essentially will be either walking independently or with some very low form of assistance like a walker. So, but it's all dependent on how you're doing prior to surgery. So, something that we say is if you look good coming in, you're going to look good coming out. And that applies to everything we do as surgeons, whether it be spine surgery, whether it be brain surgery, or anything else. So if you let a condition linger on for a long period of time where you've almost become wheelchair-bound or bedridden, it's going to take you just that much longer to recover from it. If you come walking into the hospital, there's more than likely chance that, you'll walk out of the hospital, and obviously the goal is going to be hopefully you'll be running it in a short period of time. So that's kind of a general rule.